All right, Dr. Ishwar Gilada is there with us. Dr. Gilada, the free booster doses, now it's indeed a good step, but do you think there is vaccine complacency that has set in? There's even mask complacency. People are not wearing even masks. So will this overcome that vaccine complacency, drive up the coverage of the third dose?
Yeah, I think it is a good step, and we have been demanding for last couple of months that our strategy should be scientifically based. Scientifically based means rather than having a gap of 9 months, it should be 6 months, and it has been done last week. And secondly, we have made people habituated to get everything free. And when people are habituated to getting free, then asking them to buy the third dose, they will not. Secondly, currently COVID is lying low, and people are not dying, people are not getting hospitalized, so people are becoming casual. So this is a kind of relative vaccine hesitancy. They are not hesitant to taking vaccine, but they think that why take a vaccine when there is no COVID. So in this situation, making it available for 18 to 60 population also free of charge is a great step. And thirdly, we have close to 12 crore vaccine which are going to expire in a sequential manner in July, August, and September. And this 75 days is a crucial time, because if our current consumption is 15 to 20 lakh vaccine per day, it requires 75 days to consume that many number of vaccine. So more and more people will come forward, take the vaccine. And lastly, it is important also because there are newer variants, cases are going up, and more and more people could be getting infected which are not infected earlier. The vaccine immunity which has been 1 year before, or natural infection immunity which is 1 year before, that will be waning. So in this situation, it is not only the third dose, probably it will be a kind of an annual dose also after this.
All right, Dr. Sunila Garg, member of the Lancet Commission COVID India Task Force, also with us. Dr. Garg, good afternoon. First of all, do you think, there's less than 1% coverage of the third dose? So these free vaccines, booster doses, will that drive up the third dose coverage? I want to know about that. Also, there have been 20,000 cases in the last 2 days that are being reported, and active caseload is inching up slowly and slowly. It's close to 140,000 now. There's a festival season coming up. Should we be worried?
It's a very, very important question. Number one, answering to your first question, that availability of booster doses. Basically when we are talking of from today onwards, from 18 to 59 years of age, when we are giving, there is about, population of 70 crores, what we are talking of. And only 1% of them has been vaccinated. And I was listening to Dr. Gilada, who was talking about the vaccine. It's a very, very important step. And it's not only that we will be just telling them to take the vaccine, but along with that, the hesitancy is being addressed, through the frontline workers and healthcare workers as well, because this is going to be a very, very, strategic move on part of, not only providing the vaccine, but creating awareness to come forward, but not to lose a sight of, also people who are above 60 years of age. There also we have got 26% people who are vaccinated. So, a number of cases are increasing, right, because we have got complacency also. New variants are coming who are more which are more transmissible, and that's how infectivity is more. But thanks to our previous vaccination coverage, which is 96% for first dose and about 87% for second dose, but also Omicron variant was acting as a variant of support for all of us. So that's how everybody got the natural infection as well. So whichever infection is coming, that is milder in nature, but we cannot lose a sight of the disease, because amongst us basically COVID virus is there. So we need to talk about the vaccination. We need to talk about the mask part also. Over a period of time, with all these things have gone away from our social distancing, whether we talk about hand hygiene. So all these things are also critical, which through the medium of different electronic media, print media, and all that media channels, repeatedly this information has to go.
Yes. Dr. Gilada, I want to know, what does the science say about booster doses? Do all adults need booster doses?
It says about booster dose that after 6 months the immunity wanes. But after 9 months it wanes almost fully. So if there's a natural infection, that immunity may be lasting more than a year also. But when you are taken a vaccine, the immunity will be there only for 6 months. So in that sense, you should be taking the booster or a third dose or fourth dose, whatever you say. Secondly, it is important that the newer vaccine or the newer batch of vaccine, they should also cover the newer variants. For example, BA.2, 0.75 has a vaccine escape as well as a natural infection escape. And therefore, we should have those vaccines which are polyvalent, which will cover the older as well as newer and forthcoming variants or subvariants. So we should appeal to the pharma companies which are producing the vaccine that their next batch of vaccine should cover also these things. So it is important that we should continue to take vaccine whenever, if and when made available. It is cheaper, it is easier to prevent the infection than getting infected and hospitalized, and some of them are dying. And most important is, most of the people who are dying, they are with people with comorbidity. So people during the thick of the wave, they talk about comorbidity, we should control this, we should do yoga, etc. But when they are well, they don't look. Currently, most of the people who are dying with comorbidity, they are diabetics. And diabetes has been a very chronic illness. So people should look after themselves, and we should also study why they die, how we can prevent those deaths. Though the death rate is very low now, currently 0.1% or 1 in 1,000, but we don't want even that 1% to die. So in that sense, we should study the comorbidity people. We should try to motivate them to control their comorbidities in whatever best way can. And we as young people and younger generation should control infection from getting outside to inside to the family, which are 70, 80, 90 plus people.
Right. Dr. Garg, I want to ask you, should there be a graded response to COVID spread now? If you're seeing these 20,000 plus cases for the last 2 days, should there be a graded response? Let's say if the positivity crosses a certain threshold in certain areas, should masks be brought back, or should there be restrictions on gatherings and all that? Will you advocate that? Because, the festival season is coming up. There'll be large crowds, celebrations and all of that.
See, basically, graded response is much better when we see much more higher infection rate. So far, luckily, we are not in that phase. So when we saw higher infection rate, to the positivity more than 10%. So that is where, we become conscious and we start looking at not only the infections, we start looking at hospitalizations, we start looking at the mortality part also. So that becomes important. And so graded response is always to be watchful of the situation and take action according to the point. But as of now, we see that it is, proceeding towards endemicity, and we have to see the weekly positivity rate. 2-3 days, 20,000 and then 18,000 and all makes no effect. We have to look at the weekly positivity rate, and accordingly, we have to take a step in that direction. But as of now, we feel that, still, when we talk about masks, that is still the most important social vaccine which I've seen from a public health perspective, which should always be promoted. Whenever we are in larger gatherings, and yesterday I was in FICCI and there was a big note, nobody will enter this building unless one is wearing a mask. So that puts, kind of, wherever possible in the institutions, in the hospital settings and all that, people should wear, that is wherever it is possible. And even administration has got to be sensitized towards this. So from a public health perspective, we need to have a kind of a response only when we see the weekly, not only the weekly positivity rate, but also we need to see that, in our hospitalization rate and also number of deaths which are happening. So right now, our recovery rate is also 98.5%. So far we are good. But as of now, our first strategy should be to take boosters as of now from today onwards, for people who are above 18 years of age and onwards, not to deny that people who are between 12 years onwards, they also have to complete their doses.
Yes. And Dr. Garg, very quickly, I want to ask you about younger kids for whom vaccines haven't been rolled out. They're going to schools and all of that. And with the active cases going up, are they at risk?
See, these people are at risk, but they recover very fast. It is always, if you will remember the example of influenza and all that, people said, put all these together, because they get the infection, they recover also very fast. So as I say, that the school opening and school going should not be limited to availability of the vaccines. Yes, when the vaccines are there, and they should be given to children, because outside developed countries have already started, but I don't see much from this public health perspective point of view. But if it is our priority, as has been pointed out, should be elderlies, and also people who are above 18 years of age, especially those who are suffering from comorbidities, should be given the vaccine. Between 12 to 17 years of age, we are seeing large cases of children with obesity and all. They are the ones who should be, in a priority group, but we are already giving them vaccines. But as and when the vaccines are available, they should be rolled out. But there is no compromise between the taking of the vaccine and, going to schools. Parents should not be unnecessarily scared. That is important. So the children will get the vaccine. And as of now, in the population also, Rohit, when you will go, quite a number of people are infected, but they are not brought to, the notice, because they think that it's just a sore throat and all that. Let me take this medication and I'll be recovering. And they're not brought to the attention also. So that is where there's nothing to worry about. But it is important that basically over a period of time, as in when the vaccines are available, they should be rolled out to children.
All right, Dr. Ishwar Gilada, Dr. Sunila Garg, I'm afraid that's all the time we have for this discussion. Thanks very much for sharing your perspective